digital health, and for that, let's welcome Aline from Barcelona Health Hub.
Good afternoon, everybody. So my name is Aline. I'm the Chief International Officer of Barcelona Health Hub. It's my pleasure to be here with you this afternoon to tell you more about Barcelona Health Hub's startup ecosystem and to present some of our startups. So Barcelona Health Hub, we're 100% healthcare ecosystem, health and innovation based here in Barcelona with international projection. So first, our president will tell you more about Barcelona Health Hub and our strategic expansion plan, what we will be doing, and then the starters will present their solution for 4 minutes. There won't be Q&A, so if you want to ask them some questions, just grab them when they leave the stage, look for them on the app, or you can actually find us if you look over there, Digital Health Hub. We are just below that, so you can come to the stage and find us there. So without further ado, our president, Christian Pascual, will tell you more about Barcelona Health Hub.
Thank you, Aline. Okay, so Barcelona Health Hub, it's the place to be if you want to innovate in digital health. And just to explain you a little bit about Barcelona Health Hub, we are a non-profit organization. We want to generate innovation through IT and bring it to the healthcare practice. This is our objective. We support startups. We support you. We want to help you to reach clients, the practice in healthcare. And through fostering interactions within the ecosystem is the best way to do it. So we are based in a very unique location. It's São Paulo Modernist venue. It's a UNESCO heritage place. If you have never been, please visit us. You will enjoy the visit. And we are surrounded by one big hospital, a bio-research center, the medical university. So it's a great ecosystem to innovate in healthcare in walking distance. We are already 263 companies in the association. Most of them are startups, 163. But we have also 35 corporations, mainly health insurance companies, pharma companies that are in the association. Also investors, of course. 10 investors are in the association and 55 institutions. So this is the ecosystem that you will be able to interact with when you join Barcelona Health Hub. We have been growing a lot, and our target is to be over the 300 members by the end of the year. So we want to become the largest digital health hub in Europe and a top digital health hub in the world. This is our goal. We think that we have the potential to play this game and to play a significant role as one of the main digital hubs in the world. And to do so, we have a plan. We have a strategy where we want to foster the technology transference. We want to help all the innovation that is here to reach the practice of medicine. That's a tough thing. We need validation. We need to reach the hospitals and insurance companies and these big players in the industry, and we will help you in this endeavor. Also, we want to promote the digital health knowledge to become a center of reference for the new rules, what we need to change to make things happen. We want to also incubate startups to you can have your place in our building. You can join the ecosystem being there in Barcelona Health Hub. And also, since the beginning, we have a global reach. We want to play a role in the world, not a local role, but a global role. So we have this international projection. And we want to just play a short video that you will see how we are building up this strategy. Barcelona Health Hub is a non-profit association with the mission of promoting digital health innovation and its transfer to the medical practice. We are already the largest digital health hub in Europe, but we have the potential to continue to grow and consolidate our position as a top-list global hub. For this reason, we present the key points of our strategy.
The Hospital de Sant Pau aims to provide an environment to validate the solutions and technologies that will shape the hospital of the future.
We believe it is essential to create a benchmark training center in digital health technologies and knowledge.
We want to create synergies and collaborations between the different actors of the healthcare ecosystem.
We consider it important to establish an incubator to help create and promote innovation initiatives that will lead to solutions for our health system and have international projection.
One of our main pillars is to attract venture capitalists, both national and international, to all the digital health projects that are being developed in the Hub ecosystem.
It's a great opportunity to convert new spaces within the Art Nouveau site, to expand those dedicated to innovation in digital health.
We will consolidate our position as a relevant communication channel and opinion leader in digital health.
We create and provide the technology needed to transform the digital health sector.
It will be wonderful to create a health innovation center dedicated to technological transfer to clinical practice.
We promote innovation in the medical community. That is why we support the Barcelona Health Hub in this mission.
We will increase the hub's connection with other Spanish regions, with other countries and continents.
Now more than ever, healthcare systems face major challenges. Our mission is to impulse all these innovations in order to bring them to the patient. This results in a more scalable, inclusive, and personalized healthcare. Contact us and let's start collaborating. Thank you very much. So you have seen the pictures. If you don't know it, you are able to see that it's a very nice place, but it's even nicer when you go there. So if you are innovating in digital health, please join us. We'll help you to achieve your goals. Thank you very much.
Christian. So now you know, if you want to know more about Barcelona Health Hub or the startups, so some of them are on our space over there. So go and visit us, Digital Health Hub, just below. So now I'd like to introduce our first speaker. It's from the company Qualut. So it's a technological innovation company focused on the healthcare sector, creating digital healthcare products with the aim of boosting the impact of digitalization in health. Welcome, Adele.
Thank you, Aline. Hello, everyone. Nice to meet you. Thanks for being here. My name is Audal Mas. I'm the CEO at Qualut, and I'm here to talk about digital healthcare products, user-centered and focus on the humanization. I'm here to talk about Qualut, your digital healthcare partner. But what is this exactly, Qualut? We are a technological company for innovation, hyper-specialized in the healthcare sector. We work as a partner, we work as a design agency, and as a technological company. And we even have our own projects. And why the healthcare sector? As you may know, the last year, due to COVID, lots of lacks of digitalization in the healthcare sector has been spotted, has been in the spotlight. We have seen that. And what we propose is to accompany the healthcare institutions in order to implement the solutions, in order to solve real problems. To do that, we work on the research as the base of innovation. We put the people in the center, we put the patients or the professionals in the center in order to create unique experiences and also implement technologies in the healthcare sectors. And how can we help? We can help on the research part, validating the hypothesis, validating the solutions, testing the solutions. We can work on the UX and UI design part. And here specifically we have the humanization processes that we have been leading in some projects, and the gamification processes also in lots of digital platforms. Moreover, we have the development part, which here I have to point out that the main approach is to have an API first approach, which means that we can be integrable with other solutions. This is because we think that we are in a great ecosystem, as Christian said before, and we have to add and create synergies between us, integrating all the solutions and having great impacts on the healthcare sector. And these are some of the companies that we have been working with the last year. Moreover, we aim to be in the center, in the middle of the triangle of knowledge, between connecting the business companies, the startups, the consultancy firms, the pharma companies, with the research part, institutions, technological centers, hospitals, and the education, for example, the universities. We want to be there, connecting them and transferring the technology into the market. Yeah. At the same time, we were working on our own project. For example, with Hospital Vallebron, we are working on a project called Tonificat. Tonificat is a platform that has the aim to monitor and treat the obese patients that are in treatment for losing weight before a gastric surgery. This platform is a gamified platform and personalizable platform that is already in use in the hospital, and it's in the pilot stage, but it's going to be on a clinical trial at the end of this year. Moreover, we have Laia, a platform meant to accompany women in their during motherhood, in order to prevent and monitor the mental health disorders, for example, postpartum depression. And we are going to launch this project during this second half of the year. This is the team, the founders, the core team. We have a UX UI team led by Adrian. We have the medical part, a psychologist, Irene, and a CTO for the technical lead, Rainier. And we all are waiting for you on our stand in order to create something extraordinary together. Thank you very much.
Now is Gloria, a unified customer data and business process platform built specifically for the life science industry. Welcome, Federico.
Hi everybody, my name is Federico. I am the CEO of Gloria. We provide a software as a service digital transformation platform just for life science companies. Okay. Healthcare is a complex scenario where many different actors come into play. Patients, doctors, healthcare organizations, and a lot of different providers. Have you been in a doctor consultation or asked for a recommendation from a pharmacist in the last month? For sure, you haven't asked yourself how complex is the decision-making process that lies behind that recommendation. COVID has accelerated the digitalization and changed the consumer behavior in each actor of this value chain. We are at a digital inflection point in a €1 trillion industry. So let's focus on life science companies. Traditionally, they have spent a large amount of resources in research and development while maintaining a traditional commercial model. This model usually involves large sales on-site visits, and what is most important is that this commercial model is not longer sustainable. Why? We have 3 points very important. That is, one is the high cost associated, non-data-driven decisions are made, and most importantly, they are not suitable for the new digital empowered customer. You may be asking yourself, or you may be wondering if it's too early or if it's too late. Well-known consulting firms are assuring right now, this is something updated, that commercial model in life science company must shift towards a new personalized and digital approach. That's why we have created Gloria, a software as a service digital transformation platform, especially for life science companies. Our unique value proposition consists in 3 pillars. One is a customer portal, self-service and intelligent, data platform that allows the tracking of physically and digital interactions with the customer, and most importantly, the data architecture that allows artificial intelligence algorithms for decision-making processes. Our competitors were well prepared for the first wave of digitalization, but our solution really transformed life science companies into real customer-centric ones. How attractive is this market in terms of revenues? Well, just in a nutshell, we are talking about the 17 billion euros market, just talking for platforms related to marketing, sales in life science companies. Our aim is to capture a percentage of that market. We are moving fast. We have been incorporated the company 4 months ago. We have already a pre-seed round of, we have investment for 120,000 euros. We are part of the Acelera Pyme of the Barcelona Health Hub, and we have already 2 big customers. One is Royal Canin, and another a medical devices company from Latin America. In summary, there is a big challenge. Big consulting firms are talking about how life science companies must shift their commercial models. Our business model is a software as a service specifically designed for life science companies that involves pharma, medical devices, biotech, and medical devices, medical equipment companies, sorry. And Gloria really transformed how these companies can engage with their customers. Thank you very much.
Bájate. Thank you very much, Federico. So I remind you that if you want to ask questions, so there's no Q&A here, but you can catch them when they get off the stage. You can find them in the app, or you can go on Barcelona Health Hub booth and find them there to ask them questions. So now we'll welcome our next speaker. So the company is Save Autónomos by AXA, and it's an insurtech of personal insurance for self-employed workers or freelance to cover eventualities when they cannot carry out their work. Welcome, Alex, all yours.
Thank you so much. Hola, hola. Hi, good afternoon. Let's start giving thanks to Barcelona Health Hub to let us present our project, Save Autónomos. I'm Alex. It's working? It's working, yeah. I'm Alex, CEO and co-founder of the company. As they were saying before, we are an insurance solution, an insurtech focused on freelancers, on autonomous, on self-employees, workers, with personal insurance to cover the gap of unprotection that we've got from the public system. Why, what, when start Save Autónomos? Years ago, I had a surgery on my knee, and I couldn't work during 2 years. Oh, sorry, 2 months, not too much. And the aids that I got from the public system were very scarce, were very poor. So this starts on mine. And we analyzed the freelance market in Europe, And unless we are paying the same taxes as people that are working in normal companies, we don't pay the extra that the companies are paying, that normal workers are more protected than us if something happens while we are working or when we retired. And the reality is that the trend is that we're going to beat them. Freelancers, we're increasing. We're going to be a huge population of workers. So 2 years ago, we start thinking with my partners. One is here, David, and now this project is a reality. We start on January of this year. With the solution of 3 insurance in one. Is one insurance of sick leave with daily payment. When you cannot work, you get some money. There's another insurance of accidents for big disabilities, and also a life insurance for the families. So the thing is that we start on January of this year. Our business model is viable. We're having proven and recurrent incomes. We're easy. We are clear. We're unique in the way that we are selling, because we are the only company that is selling 100% online personal insurance. And the good thing is that we're having a good KPIs. So let us invest in us. And at the beginning, I have to say that AXA, they are not partners, but they have support our project, and we are selling AXA products at the beginning of this project because they trust in us, and the pros and cons were better to start in the market with a trustworthy company as AXA is. Okay. Here is our team. We've got the, I call Cueva guys. They have been leading the biggest insurance brokerage in Spain in the first decade of the 2000. There's also David. He's a computer engineering. He has a wide experience on startups. He's been in San Francisco, and also he has a wide experience in insurance. And I'm Alex, the one that has put everything together. I'm also an entrepreneur, and I've been working in R&D and in healthcare companies. So we are now in our first round of fundraising to succeed this project, to go to the other countries of Europe, to get more clients, to acquire people and talent, and also to make our product better. So, all the entrepreneurs that are here, I encourage you, if you want to sleep peacefully, contract Safe Autonomous. So, thank you so much.
So we'll now welcome our next company. So it's SharePlay. And Juan will present one of their products called B-Seat. It's a solution to help reconnect people inside healthcare, saving time and improving the decision-making process. Welcome, Juan.
Thank you to Aline, and thank you all. And this is B-Seat. I am Juan Manuel Rios. I am the medical advisor and also the CEO of SharePlay, and I'm here to introduce you to our transparent in-room dictation for clinical environments, B-Seat. When you come to my office, I'm an orthopedic surgeon. When you come to my office, you bring complaints, and I have to do a physical exam on you. And I need to type all this in a computer in your medical record. So this is the time where you awkwardly look at the ceiling or don't know where to look with these awkward silences are happening. This is not a very easy way of documenting stuff, and also it's not the most transparent way of recording your medical records. And transparency is becoming a big thing now. It's also being enforced in many countries like the United States, where we're seeing that now there are federal laws laws that enforce doctors on being pretty transparent about what we are recording in your medical records. And there is no more transparent way than in-room clinical dictation, which means that I am not typing in a computer things in your medical record. I am dictating them in front of you. If you give me your complaints, then I do a resume of this just by dictating it to the app. This is easier, this is more comfortable for doctor and patients, but it's also a lot more transparent. And as you can see here, it has a lot of benefits included to it. So we have decided the only app that has been specifically created for clinical in-room dictation, which allows the doctor or the clinician to be 6 times faster when they have to document these medical records, but also to be a lot more transparent. As you can see, we have created a very good interface that allows this to be stored, organized, and shared between clinicians and patients. We are a very small team of 3 cousins. We are bonded by blood, and you have me, I'm an orthopedic surgeon, and also an entrepreneur for the last 5 years. Also, we have Felix, which is in charge of all the development and the computer stuff, and we have Felix Manuel, which is our marketing specialist. And through the time we have been developing this, which is almost a year, we have been able to raise capital. We have gained recognition for very, very prestigious institutions like NISA. We have been able to test our app in clinical environments, in Consorcio Sanitario Integral, in EAP Sardinia, and in various clinical environments that has allowed us to receive a very good feedback about clinical in-room dictation through our app. We are also now recently available in both app stores and in your Android store. So if you feel curious, just search Visit and you can download it for free and you can test it. So thank you very much. And if you are interested in changing the way doctors and patients exchange information, please get in contact with us. Thank you very much.
Thank you very much, Juan, and thanks everybody for being here this afternoon to listening to the startups. And remember that if you want to know more even about Barcelona Health Hub, like how we can support you as startups, or if you want to be part of the ecosystem, so we have a booth over there on the Digital Health Hub, and you can come and talk to the team. So now I would like to welcome our next company. So the company is Dule, and it's a telehealth platform fully customizable, connecting patient and healthcare professionals. Welcome, Jose Maria.
Good afternoon. Well, my name is Jose Maria Ruiz. I'm the Global Business Director at Dule Health. Well, advances in medicine have increased life expectancy globally. We live longer and we want to ensure we live better. This life expectancy increase is also a challenge for healthcare system. Chronic diseases and healthcare costs are continuously growing. Yes. In 30 years, only in Europe, people over the age of 65 will go from 19 to 28%, which will increase the stress on the healthcare system. In addition, the new old will already be digital people. The healthcare system and the insurance health sector has viability compromised under current conditions. Several studies show that telemedicine provokes increases in efficiency about over 20% in healthcare cost. In addition, a pandemic caused by COVID-19 has led to a massive acceptation of telemedicine by patients, which has meant an acceleration equivalent to 5 years. Dule is a telehealth platform that allows a holistic vision of the patient anytime and anywhere, with savings in healthcare costs and increasing patient satisfaction, as well as empowering patient self-care. Our main distinctive advantage is that it has been developed from clinical experience and from patient needs. At Dule bases our strategy in 4 pillars: communication, information, monitoring and adherence. Regarding communication, we provide a direct and secure channel communication between the healthcare team and the patients. We provide a secure and encrypted instant messaging and video call system. It allows you to be at the right place at the right time. Regarding information, we are speaking not only about repository patients' data, but also customized information about diets, about health advices or health-related news for every patient to empower patients in the co-responsibility for their health. Regarding monitoring, through external medical devices, wearables, or customized data collection forms, we take all the data and we analyze all the data applying systems of alarms and actions. Regardless the origin of the data, the proactive medicine is possible. Adherence. Through gamification, we motivate patients to increase their adherence not only to their treatments but also to their healthy habits. And finally, Dule is a telehealth platform that may interoperate with any hospital information system and may integrate third-party solutions. Thank you very much.
Thank you very much, José María. So now we will talk about artificial intelligence, like very hot topic, right? So and for this we'll have the company IOMED. So IOMED combines electronic health record database with machine learning to get accurate results, improve research outcome, and reduce the time to market, but streamlining the clinical trials. Javi, all yours.
Thank you, Aline. Thank you, everyone, for being here. As Aline was saying, I'm here to talk about data and artificial intelligence. Now, when we speak about data in clinical research, there is one of the main chapters, which is real-world data. Real-world data essentially represents everything that happens in the medical practice between patient and doctor. That's collected in what we call EHR systems, electronic health record systems. The problem about this information is that it's mainly unstructured, meaning that the bulk of this information is collected as text, as information that we cannot actually analyze, actually collect automatically. We need to manually transform it, manually collect it, read through the medical records, and so on. This takes a huge amount of time and represents a big problem when we discuss clinical research. As you all very well know, clinical research is one of the key points in the development of our healthcare system. And the problem is that when we use clinical data or real-world data for this kind of research, we find us spending a huge amount of time in collection, treatment, and cleaning of that data. What we intend to do is capsize all of this and change the data at the source. We want to change the data in the hospital. And that's what we do using natural language processing. Natural language processing is a variant of artificial intelligence that allows us to read in the clinical text and find everything that's clinically relevant in there. It's not about finding words. It's about finding context, understanding it, understanding the text as a whole, understanding all of the language, and transforming it into something usable. In this case, into structured data that we can then collect and use for different purposes. And check this out. When we use this technology, we are able to massively reduce the time of data collection. You've seen where we had 320-something hours. Now we're talking about somewhere in the between of 60 hours for the data collection. So we're massively reducing a critical part of clinical research processes here. And we are actually changing pretty much everything that's related to the collection of data, recruitment of patients, and so on. We're not only able to reduce time, we're also able to increase the amount of patients that we recruit, the amount of data that we collect, everything that we extract from that information. We are able to completely turn over all of this process. This is something that we are already doing, something that is being implemented in several hospitals in our environment. We're present in over 15 hospitals in Spain, and we're expanding currently into the UK. Also checking a program to expand into Portugal. And at the moment, we're offering access to a database of around 12 million people directly from their EHR systems. This is one of the biggest healthcare research databases currently available in the market. In order to access this, we offer basically two products, very differentiated. Compass on the one hand, product that is basically an interface that allows you to perform queries on your own and access an aggregated version of the data instantly. And then we have what we call automatic data collection, which is a service that allows you to access patient-level data for particular uses like clinical research, clinical trials, on a case-by-case format. Different variables of the same, basically different accesses to the same database. But in case you want some more information, I encourage you to come visit us at the stand of the Barcelona Health Hub. And I thank you very much for your time and your attention.
Thank you very much, Javi, and thanks everybody for being also very much on time with your presentations. So now with the next company, we're going to travel a bit to Boston with Lighthouse Disruptive Innovation Group. So it's an opportunity business builder in the Boston ecosystem, enhancing the disruptive technology transfer rate. Welcome, Natalia.
Thank you very much for letting us be here. We are traveling from Boston to introduce you this new initiative. It's everyone's personalized platform to provide continuous care to everyone. So I would like to share with you there are some data that we should know. The world population is aging, and right now all the diseases related to this are increasingly going up and rising with all the illnesses related to this, like for example Alzheimer, dementia, etc. So what will happen if we can be monitoring these people before going into that kind of illnesses? We found out that we are going to have at $1.688 trillion by 2026 for the global remote patient monitoring. So that's why we created WeShareCare, a cloud-based business platform based on a cutting-edge AI technology from peer-to-peer to connect to the continuous care and well-being business model. How we created with a plug-and-play marketplace where we can integrate different kind of technologies as software and hardware. You can access to WeShareCare at any point and any time. This is our platform where we have our cloud services, those technologies that I was commenting before, and then we have the part of the conversation when you will connect a user to a caregiver in real time. A real caregiver, yes, not an artificial intelligence. This is how it looks. Our app is based on KPIs, well-being indicators that will be checked by our caregivers. Then you will have your part as a user where you will be answered the questions about how you feel and every day for this monetary care. Our main targets are the insurance companies, the pharma part, the governments, and also the nursing homes. As I was telling you before, WeShareCare is an R&D, the B2B tech-focused initiative. Our business model is based on a franchise model, and we are in more than 6 countries right now. Like, for example, India, we all know the latest news about India, the situation that they are living there. Or for example, we are also in Panama, in the States, where we come from, Spain, and also part of Africa. I would like to tell you that our income model is based on this graphic, but the most important part is what we are creating here. We are creating a new business model based on the monitoring care. That is something that we are missing. And for example, this pandemic situation, we could avoid it if we were all having this continuous care. This is our team. We are 4 people right now in the main course, but we have our franchises. And I invite you to call and visit us in the Digital Health Hub in Barcelona Health Hub. Thank you very much.
Thank you very much, Natalia. So now I would like to welcome our next company. So it's Meditor. It's the most accurate AI-based medical assistant for triage and pre-diagnosis. Sergio, welcome.
Thanks Aline, thanks everyone for being here. My name is Sergio Raizoz. I'm responsible for business development at Meditor, and this is what I would like to share with you today. Most probably, and I'm looking around, most of you in some time, maybe you feel unwell when being at home, and you were concerned about what you could be having, right? Most probably, certainly, some of you at least have Googled for symptoms, and eventually I bet that 10 out of 10 people here probably got alarmed, got misinformed, right? That is one of the key challenges that through Meditor we are trying to solve, right? The idea here is to try to get accurate information with regards to what might be happening with you at a given point. Together with that, there is also some other thing that it's relevant, and it's the fact that today within our healthcare systems, globally I'd say, there is a definitely lack of efficiency that needs to be addressed. So in that sense, Meditor can help. We believe that we can help by means of the most accurate virtual medical assistant for triage and pre-diagnosis. It's a solution that it treasures a clinical depth which is huge. It's been in development for the past 10 years, and it's really accurate and can help you out. What Meditor is made out of, together with that clinical database that I just referred to, it's also a question of technology and user experience. User experience in the sense of a completely platform-agnostic solution that can be used virtually in every device. You can use it in web, in mobile, through voice assistants. But it's not only that. Meditor is enabled to be integrated within the platform or the applications of our customers. At the end of the day, the idea related to that user experience is to achieve a user experience which is as seamless and as smooth as possible. Because the aim of Meditor is always to get to the end of the evaluations, okay? One more thing to mention relates to how accurate Meditor is. I just said in the beginning that probably most of you at some point in time you have Googled for symptoms and you got misinformed and probably alarmed. So the only way by which that can be solved, let's say, it's by making sure that the information that Meditor is providing, it's clinically validated. And we've been doing so by testing Meditor in real conditions, in real hospitals, and with real patients. How Meditor integrates, it's something that, when speaking about the flexibility, we have realized over time that there is a bunch of solutions that at the end we could bring to different sectors in the market. Correspondingly, what we are doing is that normally we are working with the segments that you see here, and we are providing a specific or solving a specific use cases by providing the same basis solution, meaning the one related to the triage, but customized specifically to the needs of those particular businesses. So with insurance companies, it's all about growing efficiency, for instance, in the sense of driving the patient to the right level of care at the right time. With hospitals, we're doing something similar, and then we're doing specific other solutions for pharma industry and also for telemedicine companies. And Meditor is today a reality already. We have a footprint which is extensive. We are in more than 26 countries. Meditor is, by the way, a solution that has been translated into 13 languages. And to date, over this time that we've been operating, we have accumulated in our database something around 5 million consultations, which speak about how deep the knowledge around triage is in our solution today. So, thanks for listening to me. If you are further interested in knowing about digital triage, knowing about Meditor, please come visit us at the Barcelona Health Hub. Thanks a lot.
Thank you very much, Sergio. So now for the next company, we have one change of speaker. So Xavier was supposed to present the solution. You can actually find him on his booth, so under Digital Health Hub signage. And Sergio will present the solution. So the next company is Robinhat, and they represent Robin-Cam, so a surgical cap that enables surgeons to record their surgeries. Sergio, all yours.
Good afternoon all. ¿Escucha? Good afternoon, everyone. So we are Robinhat. I'm Sergio. I'm the responsible for business development, and I would like to all introduce you to our new product, which is the Robinhat camera, Robin-Cam. So basically, we are, as a company, we found out that there were different problems that weren't solved right now. We could see that surgeons were actually doing their surgeries, but they were using devices that weren't optimized for that matter. And we had to come up with a solution that was very easy, it was optimized for that, and it was especially sterilized. So we came up with an idea to simplify all this concept and basically use something that was very lightweight and could be used anywhere. So now, in the following pictures, we will see how surgeons are actually using cameras like their phones, iPads, or even GoPros, which are definitely not a sterilized tool to work, especially used in a surgery. As you can see, this is a real image. This is in Spain. And this is definitely something I don't want to be involved in when they're doing a surgery to me or one of my belongings. Now, there was definitely an opportunity that was not covered, and we came up with an idea. Obviously, when you have an idea, problems raise, right? And we had plenty of problems, especially, as I mentioned before, we had to find something that was super lightweight and it was easy to use, because when you're operating, you don't want to think about other things, right? Now, with this is the prototype that we came up with. Here you can all see it. It's a very, very small prototype, but the surgeon, when he's operating, actually, just by moving their hands next to their head, they can simply activate, stop, and start recording all images that they're seeing in real time. So now, you can, as a surgeon, you can basically record everything you do, you can share with your colleagues, you can store it, and you can share it. So it's very easy now to teach others, and that thing that before was super expensive to do, which was basically teach and learn how to do a proper surgery, now it's something that you can do actually from your house, from your home. This is basically the idea that we've come up with. Now, there's a big room for improvement. What we aim for doing is we would like to apply Wi-Fi. So basically, you could actually live stream everything you're doing. You could actually see a real-time surgery from any part of the world, real-time, with this project if we apply Wi-Fi on it. Of course, we still need to work on it, but as for now, we're still working the first prototypes. Now,
this is for us. I know there's a big room for growth, but if you have any questions, if you would like to know more information about it, please don't hesitate contacting us. We would be delighted to get to know you all. And if you have proposals or different ideas, please, you're welcome all to our booth. Thank you very much.
Very much, Sergio, and thank you to all the startups who've been pitching here this afternoon. Thank you for being here with us and listening to them. So if you want to talk to them, you can either go to our booth over there, Barcelona Health Hub. You can visit our website, or you can come and see us, and we can help you to get in touch. If you want more information about Barcelona Health Hub, if you want to join the ecosystem, become a member, come and talk to us. And if you're interested in 5G technology and how it can be applied to healthcare, I will be talking about that in 50 minutes on the Agora stage, so the application of 5G in healthcare. So thanks everybody, and have the nice rest of the conference.